right, those of you that have knee pain when you exercise, this video is for you. So if you have knee pain, say you get, if you're doing a squat and you get knee pain in this muscle here, or you feel it medially here or laterally, you need to start releasing tension above and below the joint, okay? So a lot of times what happens is when we get a lot of stress on our joint, there's probably dysfunction above and below the joint regarding the muscles, okay? So we probably got some tension or weakness in the quadriceps, and we probably got some tension in the lower leg or weakness in your hamstrings. Whatever the case is, there's likely some type of dysfunction, all right? And when you have dysfunction in muscle bellies above or below a joint, your body compensates by using the strongest structures available to perform an action, okay? So a lot of times that's going to be right at the tendon and ligament area of the joint, okay? So every time you run or every time you do an exercise, all the force and energy is being absorbed down at the joint as opposed to the muscle bellies, okay? So we want the muscle bellies above and below the joint and the muscles surrounding the joint to be absorbing that force. Okay, for a lot of you, they do not do that because we're so tight in our quadriceps, we're so tight in our hamstrings and calves that we're just adding more and more stress to that joint. That's why we have joint pain whether we walk or if we run, if we do squats, deadlifts, lunges, whatever the case is, we likely have some type of dysfunction if we are feeling pain. So that's why we need to start making sure we're rolling out prior to our workouts, okay? So we need to make sure that there's nice blood flow. There's no lactic acid built up in there. There's no tender points or trigger points that are preventing these muscles from contracting and releasing properly, okay? So if we're riddled with knots, we're going to have less and less muscle fibers contracting and releasing, okay? They're going to be bound together, all right? If you have those muscles bound together, and you have enough of them like that, of course, there's not going to be a lot of activation. Of course, there's going to be dysfunction in that muscle. All right. So that's why when we foam roll, we release and we stretch, we're getting nice activity from the nerves. We're getting nice blood flow, nice oxygen flow, nice nutrient flow into the muscle bellies. OK, that's why you feel so much better after massage when you get your quadriceps rolled out and your legs worked out is you got nice blood flow into your body, nice blood flow into those muscles. So you feel lighter on your feet. You feel a lot less stress on your joints because muscles are actually working how they're supposed to be working as opposed to your joints taking on that stress. Okay. So that's why we use these guys. Anytime my client is having a pain usually they'll have it maybe right in this area here. So if they're having pain here, 100% of the time, I'm always able to find that knot that's causing that pain. And sure enough, we get that thing released and they're able to do the exercise with no issue. Okay, so we continue the exercise and they have no issue. If it comes up again, we just release that same spot. Okay, and then that's going to be the area that they need to focus on going forward, making sure that they're keeping that muscle relaxed as often as they can, so so they don't continue getting that issue over and over again. All right, so it can be that simple sometimes. It really can be that simple, just a matter of releasing tensions or releasing knots in the muscle bellies to get rid of that joint pain. All right. It's not always 100%, but most cases, if we get the tension above and below the joint released, we can have a lot less pain when we work out, if not no pain. All right. So you just do this stuff. I'm telling you it helps. I'm telling you it works. Do it all the time with my clients. And keep in mind, if we ignore this issue, so if we ignore this dysfunction above and below the joint, and we create instability in your knee, so a knee is a stable joint. If this gets dysfunctional, what happens is your body compensates by creating more stability in an adjacent joint. Okay, so if we have instability here, our body compensates by creating more stability in this ankle. Okay, so that more stability coming from that ankle is compromising mobility coming from the ankle. Okay, so they give up mobility here to provide more stability. Okay, You would think that's good, but it's not, because it's going to cause tightness and issue. It's going to cause limited range of motion. It's going to change your gait. It's going to change how you walk. It's going to create more issues up the chain. Okay, so that's how joints play off of each other. That's how they work. That's how your body compensates. All right, that's why we want our joints nice and healthy and nice and functional. Our muscles nice and functional, nice and healthy. And same thing, we'll do it for me. If you are someone with hip pain, we'll talk about that. So if you have dysfunction in your knee, so lose stability here, and your body compensates by creating extra stability in your hip, you sacrifice hip mobility. Okay, so your hip gets limited range of motion because it's trying to provide extra stability due to the lack of stability in your knee. Okay, it's just constant cycle of issues if we do not keep our muscles healthy, if we do not keep our muscles strong. And I see it all the time. Okay, so start releasing your muscles regularly. If you do it once a week, you need to increase it to at least 4. Okay, just do it. Get in the habit of doing it. I promise you it will help. I promise you it does help. And it's very necessary. All right, it's very necessary. And that being said, I believe that's everything. All right, so I will see you on the next video.